Hey guys, this is Paul Lynch. I'm an anesthesiologist and pain management doctor from Scottsdale, Arizona. Many people have followed me over the last year as I went to New York City and worked in the ICU when COVID first hit in April of 2020. And then I've continued to try to make educational videos to help people that are wondering about what's going on with COVID. I'm coming to you from the road today. My son has a golf tournament, and so I had some time here, and I thought I would make a video. And I wanted to do things a little bit differently today. I've got just a ton of questions. I mean, honestly, every day I get questions from people on COVID now. I've been educating, for a while on this. And so I pulled out 13 of what I thought were the best questions that I've got over the last, say, 2 weeks or so, and I wanted to answer some of them here. And so these are real questions from some of my followers, and I'm going to try to go through them as quick as I can. Please feel free to share this video if you think it would help people, and we're just going to jump right in here. So here's the first one. When can we get back to normal? I mean, that's the million-dollar question. I've got that question maybe 10 or 15 times just in the last couple of weeks. And so I kind of looked into it a little bit, and I'd like to give you kind of my mathematical assessment. So based on the current R naught of COVID-19, we think between 60 and 70% of the United States needs to be exposed either to get COVID or to get vaccinated before we establish herd immunity. So I'm going to take 65% as the midpoint of the range of the experts. So if you take 65% times our population of about 335 million, it's about 217 million Americans that need to either get COVID or get vaccinated. And the question is, where are we at today? Well, we've reported over 25 million cases, and anyone who's followed my videos in the past, you can probably multiply the actual known cases, 25 million, times about 3 to find out the actual number of people who've been exposed. So that would bring us up to about 75 million that have been exposed. And if you've been following the news the last couple of weeks, we've actually at least given the first dose of vaccination to 20 million Americans so far. So 20 million plus the 75 million is around 95 million people so far, and we have to go to 217 million. So we're not even halfway there yet to herd immunity. I saw President Biden give a speech that he's going to try to give 100 million vaccination doses in the first 100 days. And a lot of people said that might be too aggressive, but I went and read about it, and a lot of experts are actually saying that we might be able to pull this off. We've been ramping and getting ready for this moment since July, and so the 2 mRNA vaccines are ready to go. They've been increasing. It looks like each of these companies will be able to deliver close to 1 billion doses this year, and so they're ramping up. And then we have AstraZeneca and Johnson & Johnson coming close on their heels. So long story short, I think it's possible that we could vaccinate another 100 million in 100 days. Some of it's going to depend on you guys and whether you want to get vaccinated. But my best guess is that we can hit this 217 million mark with a combination of people getting COVID and getting vaccinated by May 23rd. That's my guess to this answer. May 23rd, I think we will establish a fairly robust level of herd immunity. And so that's what I'm preparing for in my own business, and that's the advice I'll give here today. Now, there's a lot of things that could affect that, decrease adoption of the vaccine by the public, or something happens with production, or a variant of the disease I don't know about. But right now, my guess is 120 days or May 23rd. Question 2. Is the coronavirus as bad as the Spanish flu? Well, it depends on how you look at it, but I think the answer is yes, at least in America. If you look at the Spanish flu, there's a lot less people in the world at that time. It infected in the world 500 million people, or a third of the planet at that time, and worldwide it killed 20 to 50 million people. In the United States, it killed 675,000 people, and we are well on our way to exceed that number with COVID. Now, I think the way it's going to play out is because COVID hit the United States disproportionately compared to the rest of the world. We mobilized our forces quickly. We made the vaccines. We're going to first save America, and then I think we're going to be part of distributing this to the rest of the world. So I don't think that the Spanish flu will kill as many people in the world. I don't think COVID will kill as many people in the world as Spanish flu, but I think it'll exceed that number in the United States. And I just want to pause on this for a minute. I remember last year, when COVID was first hitting, I was in New York and I was seeing people die at just an incredible clip. And someone, I can't remember exactly when or where now, but they made the estimate that as many as 2.2 million Americans would die if we didn't do anything. And that number was kind of widely mocked and ridiculed and saying, oh, that's crazy. It's never going to be 2 million. But That honestly probably would have been the number had we not done all the things that we did. And so when I'm talking to people, I say I think we should be proud of what we've done over the last year. I think we've saved lives. Right now, the number today is 430,000 reported dead in the United States. That number is expected to go to around 580,000 dead by May 1st when we're starting to get levels of herd immunity. But if you've watched some of my videos in the past, you can probably multiply that number by 1.5 to account for all the unaccounted for COVID deaths, plus all the downstream effect of COVID, all the things, because people don't want to go to the hospital, and the depression and the suicides and the overdoses and just all the other effects of COVID. And so if you multiply that 580,000 by 1.5, it's more like about 850,000 dead in about 13 months or 14 months. And then I would guesstimate that by the end of 2021, there'll end up being maybe 1 million dead total from COVID and its effects. So that 2.2 million number versus 1 million, is clearly we saved a bunch of lives, but it wasn't that far off. So in the end, to answer the question, I think we're going to lose more people in the United States to COVID than we did the Spanish flu, but the overall effect on the world will be less, a lot because of American leadership and what we've done bringing these vaccines to market really quick. Question number 3. I saw you got the vaccine, Dr. Lynch, but you already had COVID. Why did you get the vaccine? Well, my simple answer is because the CDC said I should. And so, the CDC has taken a ton of criticism throughout this pandemic, but man, I've followed their website, the NIH, the CDC, and I've been looking at their recommendations daily, and they've strongly recommended that all healthcare workers get vaccinated for several reasons. One, we're constantly exposed, and 2, we can give it to other people. And so I got vaccinated. Now the question is, since I already got COVID, do I even need to be vaccinated? And the answer is probably yes. I got COVID way back in April of 2020, so it's been like 9 months now, and data shows that your antibodies start to wane over time. And so getting vaccinated is a much more robust immune response. They've actually looked at people who got COVID versus people who got vaccinated, and the antibody levels are a lot higher when you get vaccinated. And so it's a much more robust response, and it's a more predictable response. If 100 million of us get vaccinated, over the next 100 days, we'll be able to track everyone and get a sense of when we can get COVID again. We don't completely know that, but most scientists think somewhere between 1 year and 3 years, we may be able to get COVID again. And so we're still trying to figure out when we have to get vaccinated again. My best guess is 2 years. I'm thinking it's going to last 2 years. But with all the variants that are out there, maybe it ends up being once a year we get vaccinated, which ends up being not much different than getting the flu shot every year. So we'll see how that plays out. Next question, is the vaccine safe? I get this a lot. So yeah, the data from the Moderna and the Pfizer studies, these are mRNA vaccines. They take a very small sequence of nucleotide information and they put it into your body. It doesn't make the vaccine. It's not a live virus. It's not a dead virus. It's not a virus at all. It literally is just a small little sequence of messenger RNA that tells your body how to make a little piece of protein, and then you make antibodies to that protein. And if you ever see the virus in the future, then you can fight it. I saw one famous epidemiologist who said it's almost like a Snapchat message, like an email to your immune system that tells you how to fight it in the future, and then it disappears. And so you have that information, but it's really safe. They actually tracked about 75,000 people in the 2 studies, and there was really no bad side effects. 10 to 15% of people got a sore arm, maybe a little bit tired, maybe small fevers, but no one had bad side effects. And we're 6 or 7 months in now, and there's been no neurologic disorders or really anything. So yes, it's safe, and the data is incredible, 95% reduction. So yeah. All right, next question. Am I right to be nervous about the vaccine? Sure, yeah. No, I've had these conversations all the time that, we brought these vaccines to market in, less than 12 months, and a lot of people are distrustful of the government, and I understand that. But I would think about it less as about the government and more about doctors. There's a lot of really smart epidemiologists and infectious disease docs that have looked at the data, that have tracked this from the beginning, and it works. The data shows that it's going to decrease our chance of dying, that there's very little side effects. And, one of the things I've been telling my staff and friends that ask me is, sometimes doctors tell us really scary things that we don't want to hear. Like, let's say you have cancer and you go to a doctor and they say, yeah, we're going to give you this really crazy cocktail drugs, chemotherapy that's almost going to kill you, but it's not going to kill you, but it might kill the cancer drug. Some people hear that speech and say, you know what, I don't want chemotherapy, I'm just going to die. But the vast majority of us will talk with the doctors, we'll look at the research, and we make the decision that chemotherapy, even though it's a scary thing, even though it might make you sick, even though you may not completely understand it. You trust the doctor that they've done this before and they've saved lives, and you do it. I've seen so many patients that have their lives have been saved because of chemotherapy. And I can make the same analogy about open heart surgery. We tell patients we're going to open your heart and we're going to crack your chest and we're going to go down. We're going to stop your heart. I mean, think about that. Stop your heart. You're basically dead. And we're going to oxygenate your blood on a machine outside your body. And we're almost going to kill you. We're going to take you right to death's door. But then we're going to fix your heart. We're going to put you back together. We're going to start your heart again, and you're going to be just fine. I'm an anesthesiologist, so I've done those cases, cardiac cases, like 100 times during my training. And every time I was blown away by science and that we could save lives with medical treatment, And so I think we're kind of used to doing some kind of scary things in medicine to save lives. And I think it's time to do that again with this vaccine. And so I think to answer your question, you're totally right to be nervous, but I think we also need to trust physicians in this situation. Here's a question I got just yesterday about Arizona is pretty lax in our approach to COVID, and California's on total lockdown. They said, well, isn't California doing just as bad as we are? So I looked into the data yesterday, and the answer is no, Arizona's doing a whole lot worse. You really need to look at things on a per capita basis. And so if you look at Arizona, we've lost about twice as many people as California on a per capita basis. And so the decisions that we've made of not really wearing masks and not really taking this as seriously, it's led to more death and destruction here locally. And that bothers me as an Arizonan. Let me tell you the data differently. If California was running the entire United States, I know this scares people. There's on social media, people like to attack California, and I understand that. But if California was running the United States, instead of losing 430,000, we probably would have lost about 250,000 based on their deaths on a per capita basis. And if Arizona was running the entire United States, we would have lost about 550,000 people. And so if Arizona was making the rules for the entire United States, we would have lost another 120,000 lives. And that may not seem like a lot, but that's a lot of life and death and destruction and families and moms and dads that won't be there for Christmas this year. So no, California is actually doing a lot better than Arizona, and probably part of that is that they take it a lot more seriously. Question number 7, this is a tough one. Was this virus made in a lab? Maybe. I mean, this is a controversial question. I don't completely want to get into that today, but it's possible. There is a lot of research out there if you take the time to look into it, gain of function research, where there are epidemiologists and virologists around the world that look at viruses and study them in a lab, and they are doing research studies on seeing if they can make them even worse than they are. That might sound crazy to you. It kind of sounds crazy to me, but they're doing it with the idea that when these things happen, they're trying to predict what the virus is going to do naturally. And when that comes out, that we'll be quickly able to treat it. It's one of the reasons we're able to come up with the messenger RNA technology so fast, is there's people behind the scenes like thinking about this and planning for it and expecting it to happen. But sometimes these viruses escape, and there's been lots of documented cases of this. So people who think that this virus came from a lab, that's not a crazy conspiracy theory. It actually could be true. Most scientists have looked at it and said they don't think it came from a lab, but I don't completely know. I think the jury's still out. I've been reading a little bit about this. If you have more questions about that, you can reach out to me on that one. How about this one? Does ivermectin work? So I've been getting a lot of this lately. Ivermectin is kind of the new hydroxychloroquine on social media, where a lot of people think it's like the greatest drug ever. But Nature came out with an article about a month or two. I'll try to put this below, basically saying there's so much excitement for ivermectin, but the data doesn't really support it right now. Now, could it work? Maybe, but so far the studies haven't really mathematically borne out that it works. And so I would probably reduce your excitement about ivermectin. Here's one similar. Does monoclonal antibody therapy work? Probably yes. So I say probably no on ivermectin, probably yes on monoclonal antibody therapy. Once again, the NIH hasn't given its full support yet because there's a couple of big studies ongoing, but the data early on was incredible from monoclonal antibody. This is what our former President Trump got when he got sick, and he got rapidly better. Anecdotally, I had a friend a couple of weeks ago who was really sick with COVID, and she got monoclonal antibody therapy and got rapidly better. Matter of fact, the studies that I reviewed, there's 2 different companies making it, and both of them showed almost the same thing, about 90% reduction in symptomatic COVID. And so this is really interesting area of therapy that we need to kind of keep our eye on. We'll probably have all the answers in the next 30 to 60 days. I get this question almost daily. I was just diagnosed with COVID. What should I do to stay safe? So I tell people, and this is all from the NIH website as well. I've been researching this whole year. There's some vitamins and minerals and things that you can do at home that make you less likely to get really sick. So vitamin D, vitamin K, vitamin C, quercetin, zinc, and melatonin. Those are all evidence-based. What's really crazy is a lot of these things are also really helpful for pain. So we've been working behind the scenes for the last couple of months to have a cocktail for our patients that will help for their pain. And what's crazy is a lot of the same things that we'll give them for pain also help with COVID. So I'm hoping to have that ready in the next 30 to 60 days. And you can reach out to me if you want more information about that. The only other thing I'll add, I'll say it again, vitamin D, vitamin K, vitamin C, quercetin, zinc, and melatonin. That's what's evidence-based. But I would add to it plenty of fluids, because when you get COVID, you can get really, really sick. One of my employees called me this week and they couldn't keep anything down. They were vomiting, they were sick. And so you always want to drink plenty of fluids, and not just fluids, but fluids that have electrolytes. And so things like Gatorade or Pedialyte, just fluids plus electrolytes. And then I tell people, especially going through this global pandemic, make sure you can do your vitals at home. So get like a pulse ox, and that'll tell you how much oxygen is in your blood. But you can also get like little portable machines that do heart rate and blood pressure. My mom and stepfather, I even helped them get one that has EKG, and so you can do an EKG lead, and it comes in handy to be able to do your own EKG at home, see what's going on with your heart. And so yeah, if you can take your own vitals at home, take fluids plus the vitamins that I mentioned, that's the best thing you can do. Okay, 2 more questions. When should I go to the hospital if I'm sick with COVID? So I kind of hinted at this, but if there's a way for you to take your vitals at home, it makes it easy. You know, a heart rate above 100, blood pressure less than 90 over 60, or O2 sats in the 80s, I would definitely go to the hospital. I think if you feel like you can't keep anything down and you're vomiting, weight is also a really thing to do at home. You can take your own weight. And so when you first get the diagnosis of COVID, maybe take your weight and have your baseline. And then if your weight starts to drop more than, 3 or 4%, then you're dehydrated. And so that's a good time to go to the hospital and get, IVs. When I was sick with COVID in the hotel room, my SAT dropped into like the mid 80s. And so I would tell someone, when your SAT goes in the 80s, you should definitely go to the hospital. I kind of didn't follow that advice, kind of like men driving. Like, I got this, I can take care of it myself. And so it was a little scary for me, but I am an anesthesiologist. And so I felt semi-comfortable that I can manage myself at home. But there's a certain point where you should go to the hospital. I know a lot of people have been avoiding the hospital because of COVID. But if you're sick with COVID at home, there's a certain point where you have to go in. And so if you have questions, you can always reach out to me. I've probably got this question 25 or 30 times this year. Should I go to the hospital? And then last question, and I'll be done for today. Do masks work? Oh man, so I get this question lots in lots of different formats. I know it's kind of controversial for some people, but it's not controversial anymore. There's been tons of data this year. Wearing masks work. The combination of socially distancing and wearing masks, you're going to decrease the transmission significantly. But one thing I'll add to this today, we've had about a year of producing masks, and now there are tons of N95s out there and available. Maybe make it a goal this week to get your own N95. So step it up a little bit. So the N95, the way it works, it's actually going to filter out a whole lot more of the virus than just a normal mask. And so I would just recommend everyone go online, do your research, and see if you can't get an N95 mask. It's actually going to work even better and reduce your chance of getting it or spreading it to others. I'm actually, just as I was preparing to answer this question, just going to double down that I'll always wear my own N95. At this point, I've got COVID. I've been vaccinated. It's very unlikely that I'm going to be part of kind of spreading this, but I could still get COVID and spread it to other people. And that's what's weird, is I would be asymptomatic, but I might have it. And so I'm going to push myself to start wearing my N95s more myself. Okay, I hope that was helpful for you guys. If you think this is a good video and could help some of your friends, please feel free to share it. I think it could help people and maybe save a life, which is the most important part for me. I want to look back on this and feel like I did everything I could during this pandemic, and that maybe I was part of saving some lives. Maybe you'll have a chance to save lives too by sharing this with others. God bless you guys. Stay safe, and I'll see you next time.